Certified registered nurse anesthetists, or CRNAs, have been providing anesthesia to patients for more than 150 years. But in New York, the nearly 2,000 CRNAs working here don't have a license that reflects the full extent of their training. This month, they rallied at the Capitol to urge lawmakers to pass a bill that would formally recognize their profession. I had a chance to speak to some CRNAs who say doing that would mean better access to care for patients. If you've ever had surgery, it's likely a certified registered nurse anesthetist was involved in your anesthesia care. That's according to the president of the New York State Association of Nurse Anesthetists, Sean McGarry.
So what we're doing is asking the state legislature to recognize the profession with a license that recognizes our education and training.
New York is the only state in the nation that does not formally recognize the CRNA profession. These advanced practice registered nurses are urging lawmakers to change that.
We believe that we play an essential role in ensuring that patients have access to these critical anesthesia services. And as often serving as the sole provider in rural and underserved areas, the passing of legislation that would recognize us formally in state education law would increase both the quality and access to the anesthesia and surgical services across the state.
Despite their more than 7 years of education, current state law limits a CRNA's ability to practice to the full extent of their training. For instance, CRNAs like Jeremy Lombardoni can only work under physician supervision.
And it is just a signature. No doctor's actually supervising our anesthesia.
But throughout the COVID-19 pandemic, that requirement was lifted, allowing CRNAs to care for more patients in a workforce shortage.
Because there is no physician anesthesia or nurse anesthesia per se, there's just anesthesia. And the way in which that we provide those anesthetics are the same.
Another layer of this is pain management, a key part of administering anesthesia. CRNAs are extensively trained in managing pain without narcotics. With rising rates in opioid addiction and overdose deaths, they can play a critical role in saving lives.
A lot of the addiction could start with this guy right here. You come in for a procedure and you've never had narcotics, you never touched one in your life, and you need your gallbladder out. And then I start the process with giving narcotics for surgery, and then you get some pills to take home, and then it can start there.
The police in this little town almost every day have to pull a pen of Narcan out of their pocket and stick it in somebody whose breathing has stopped because they're addicted to narcotics.
Dr. Peter Dowling has worked in this rural hospital for about 20 years. Last year, he underwent a partial knee replacement and sought out Jeremy to provide opioid-free treatment.
Woke up the next day, didn't need any pain medicine, started doing physical therapy where you on purpose bend the joint you just had surgery on, didn't have any pain with that either. So it was a miracle.
Jeremy's ability to do that is thanks to his extensive education, an education CRNAs say deserves to be reflected by their license.